Hi, my name is Dr. Santosh Tiwari. I'm a practicing physician and diabetologist at Sri Siddhi Multi-Speciality Hospital, Govandi. Today we are going to talk about diabetes. First, what is diabetes? Diabetes is a state of chronic hyperglycemia. It's like when your blood sugar levels are chronically high, when our blood sugar levels are more than 100 milligram per deciliter in a fasting state and more than 140 milligram per deciliter in postprandial, that is 2 hours after breakfast. Or if your random blood sugar, that is whenever you check your blood sugar, it is more than 200, then possibly you are suffering from diabetes. Then second thing is, what are the types of diabetes? Diabetes, mainly there are type 1 diabetes, type 2 diabetes. Type 1 diabetes is rare. It occurs in approximately 4 to 5% of the patient. The patients are usually young patients, and it is because the insulin, which is normally controls the blood sugar levels in our blood, is destroyed, or the organ which is producing insulin are destroyed because of autoimmunity. Type 2 diabetes is more common. It occurs in approximately 90 to 95% of the patients. It is because of reduced production of insulin or because of insulin resistance. Means either the insulin is not produced in a sufficient number, or if it is produced, but it cannot act in a normal manner on the peripheral tissues which utilize glucose. See, in either way, the net result is your chronically high blood sugars levels in blood. How we can check whether a patient is suffering from diabetes or not? There are multiple tests. First, you have to undergo a blood test known as blood sugar fasting and postprandial levels. Your fasting levels should be less than 100 milligram, and your postprandial levels should be less than 140. There is one test called as HbA1c, uh, or glycosylated hemoglobin. Determines the last 3 months ka average blood sugar levels. Then, what are the symptoms of diabetes? Patients who are suffering from diabetes, they have following symptoms. First, there is increased urination, frequency of urination. Second, patient has increased thirst. Patient has increased appetite. In spite of increased thirst and appetite, patient is losing weight. Patient has severe weakness, loss of around 4 to 8 kg of weight. These are the symptoms of diabetes. If you are having these symptoms, you should probably see a physician or your general physician, family physician, and get your blood sugar checked.